Good morning and thank you for joining us. We're but 4 days short of Christmas Day. Borders have opened and the Australian cold chain is in the midst of its busiest time of year. Joining us today are a panel of specialists in their field that I've gathered to share what I see as critical intel and learnings from a year just gone. When moving through COVID cases on site, New South Wales, for instance, have just recorded this morning over 3,000 cases alone. The three people that I have chosen to represent the cold chain warehouses, the logistics side of things, and also labour hire, so people that are across the board. So welcome, Chris Harrison. How are you today?
I'm well, thanks, Marianne.
That's good. Chris, you're the Lineage Logistics Director of Safety and Compliance Asia Pac, correct?
That's correct, yes.
Excellent. And Nick Lindsay from Lindsay Australia, you are the Fleet Quality and Efficiency Manager.
Morning, Marianne. Yes, I am.
Thank you. And David Chernich from Labour Force ANZ Safety Manager.
Hi, Marianne, and welcome everybody.
Yeah, thank you, gentlemen, for joining us. I'm going to start with you, Chris. How did your company handle outbreaks on site, for instance?
It was very much a case-by-case basis, Marianne. It depended on the size of the site, the number of positive cases that we had, and whether we were able to effectively isolate a certain section of a site to manage it and contain it. So it very much is about being aware of your sites, how they're set up, and then the ability to manage individual outbreaks.
Thank you. And you've just touched on something that I'll probably speak about a little bit later, is isolating certain groups of people so they would never come in contact with each other. So if there was a case in that shift, you didn't wipe out your entire workforce in one hit. That's correct?
And that's part of, I think, about being prepared for COVID when and if it does arrive, is where you can set up separate shifts with gaps between your shift start times, work group bubbles, so that you minimize exposure and then therefore potential impact on the business.
Yeah, no, that's a fair call. And Nick, being in logistics, how did your company handle outbreaks within the trucks and also between states? That would have been fairly tricky, I'd imagine.
Yeah, very challenging. We were fortunate enough not to actually have an outbreak on any of our sites, but we went down the path of ensuring segregation on the site. So we minimised some of those common area interactions. We hired some demountable buildings so that we could give the same essential sort of infrastructure to all staff without putting them in a position where they were mingling with one another. So additional smoker rooms, additional break rooms. We isolated maintenance with administration, with warehousing. So we just did our best to avoid, if there was an outbreak, that it was limited to certain parts of the business. As far as cross-border travel, unfortunately, our poor drivers were doing their best to rest in their vehicles and to avoid interactions with the depot staff. So as unfortunate as it was, they've done a great job and were patient enough to make sure that they didn't do anything additional to increase the risk.
Yeah, and shout out to all the drivers, by the way. That's they've had an incredible couple of years and it's been horribly difficult. I don't think anyone that is in the know would deny that. And over to you, David. When you're working within labour hire, you're working over many companies. How did you assist different companies with their shifts and staffing on site?
Well, one of the things with labour hire is that sometimes they can go to several locations for work, but during COVID, you have to keep them at the one location and not give them other shifts at other locations, because if they're infected, then you're virtually going to spread it to multiple locations. So, and it's the biggest thing with COVID and labour hire is really working with the business, the host client, in what is actually happening on site. If there's an outbreak, what Chris was saying is isolating that area and then going through running checks with the other staff within that area.
Oh, that's good explanation. And how did you find, so, one of the things I wanted to touch on today particularly was Victoria, I think, copped it first, then New South Wales. There are things that would have been done, and looking in retrospect, there must have been times where you thought, gee, we could have done that better, or I would have done it differently, knowing. So as far as advice goes, Chris, for instance, what sort of advice, what sort of things would you have done differently, or what would you do now? And what advice would you give companies in the likes of Queensland, South Australia, Northern Territory, WA, that haven't been so far as heavily affected?
Yeah, look, I've been thinking about that question, and I think the key to this is being prepared, is understand the ramifications to your business if you do get a positive case. So what are the mitigating factors that you can put in place? For instance, one of the learnings we had was ensuring that density limits, that you separate, like Nick was saying, your major players in different offices so you don't risk losing key players at any time. Having the ability to allow them to work from home if they are deemed a close contact. So getting in place remote access, laptops, etc., so that you don't have that big an impact on your workforce. Looking at how you can set up your offices to manage COVID. So physical barriers between drivers' windows and admin staff. So things like that, I think were areas that had we known, certainly in Victoria when we had some of our first cases, would have made life a lot easier. When we played them out in New South Wales, when we had a subsequent one, made life a lot easier. So I think that's the benefit, is being prepared, understand what your business continuity plan is relating to a virus like COVID, but it's probably going to be something that we're going to have to learn to live with going forward.
Absolutely, and good advice. Nick, what would you say, again, looking behind you, sitting here now, what would you do differently that you feel would have been a good thing if you'd been upfront with it?
Similar to Chris, I guess, but something I was thinking about to respond now was just giving the confidence to the employees and the staff. So clear communication and being upfront about the direction the business is going in. So although we had high level crisis meetings and we were forward planning a lot of the moves we were making, it's difficult to manage the balance between too much information creating panic and enough information to give employees confidence to come to work. David would have noticed an increase in agency use because of a lot of people in Sydney and Melbourne, in increase in absenteeism because there was a little bit of innuendo around what the company's doing to provide a safe working environment. So I think getting on the front foot there, explaining exactly what you're doing and why it matters and the direction you want to go in, that's imperative to get people to come to work and to provide them a safe workplace.
That's great advice. And David, that is a great segue into labour hire as well.
Yeah, I was just going to say, look, communication is definitely the biggest issue, especially on sites that have outbreaks, because what we see is that you have other staff that don't want to go. They're refusing shifts or not turning up, which makes it hard to replace them and fill shifts because the client is saying, well, we need X amount of people. But do you just pull people from other sites, or do you sticking to the clear direction you're going and limiting them to one site only? The other thing I would like to point out as well is that for small businesses, look out for the actual letters from doctors, especially if there's a mandate coming in for Queensland. A doctor may write a letter saying, look, welcome Joe Smith, thanks for coming in for your vaccination shot. You may get these symptoms, but that worker may not have actually had their vaccination. So if there's a mandate that's coming in, you need actual confirmation proof that they have had the vaccination and not just a letter that they've paid a doctor to write.
Yeah, that's a good point. Nick, how did you find What was the best communication that you were able to use? Was it written? Was it on site? Was it face to face? Did you have a doctor in? What did you find worked best for Lindsay Australia?
We left no stone unturned, so it was digital communication, physical, face-to-face, notice boards, text messages. We're lucky enough that we have a lot of support from our employee group and engage on social media. So everywhere we could, we penetrated communication that way. We had on-site testing, PCR testing and rapid testing. So whilst we had the specialists here, they were kind enough to have small talk with the employees and to reassure them what we're doing for the right reason and that type of stuff. So every opportunity you get to communicate a message, you take it, and whatever format's available, you use it.
That's brilliant feedback. Thank you. Chris, was it similar with you, or could you add anything to that? Because that sounds pretty comprehensive, Nick.
Absolutely comprehensive, and I agree. I think any opportunity for communication, and to, like David was saying as well, keep people informed with what's happening. If there is a positive case, let people know. So in the absence of information, people make stuff up. So you need to be on the front foot, let people know, give them confidence that as a management team that you're understanding of what's happening and that you're in control of it.
Yeah, that's a good point. I think there's nothing that creates more fear than hearing it secondhand, because it takes a nanosecond for that to turn into a pretty effective story that can cripple a workforce very quickly. The testing that was, particularly with Victoria, I found, Chris, with a lot of government meetings that were happening, there was wastewater testing, PCR testing, rapid antigen testing. Did Lineage do one, some, all, and do you find that any were more effective? What would you recommend?
Look, we've done all of them and are subject to wastewater surveillance testing at 3 of our large sites as required. Wastewater testing's been a little bit hit and miss. We've had positive cases identified on site that weren't picked up by wastewater. Conversely, recently we've had a case where wastewater has identified viral load within the wastewater, and we found a positive case on site. So wastewater's been a little hit and miss. We've used rapid antigen testing as a management tool, as well as for testing new starters on site. So we've used it sparingly because there is a significant cost implication to conducting rapid antigen testing. PCR testing, we haven't had, like Lindsay's PCR testing on site. Where we've used that is to use state-run hubs.
You just touched on something. You said there was a cost involved. I believe that around Australia, some places were spending hundreds of thousands a month. Is that correct? Sound right?
If not more. If you look at the average price of a rapid antigen test of, say, $11 per test, and you times that by your workforce, whether you're doing it daily, 3 days, that's a significant cost to a business. Did
you find the same, Nick?
Yeah, it was difficult at the outset because there wasn't a lot of government support there, and we were increase in PPE, increase in cleaning, increase in testing, and you were just getting hit left, right, and centre. And there's no real way to recoup that money from the consumer. So ultimately, it's the cost of doing business through COVID. But we were lucky that sort of as 2020 finished off, Medicare came to the party and the government started funding PCR testing for heavy vehicle drivers. So, but just to reiterate the importance of rapid testing, again, that helps with employee confidence. When they come to work and you're doing something proactive such as rapid testing, it gives them that, again, the confidence to come to work and knowing that there isn't a risk of infection. And it gives us and our customers an element of continuity. Lindsay's is doing everything they can to keep the wheels turning.
Absolutely. And what, David, with working with different companies across the board, you have to work your way through each company individually the way that they want to do it, but also to protect your people. Was there any difference or anything that you did in addition?
Look, one thing we looked at was carpooling as well, because especially with casuals, some workers tend to carpool. So if you get 3 workers in the same car, there's 3 exposures. So we tried to stop carpooling, and we went through and ask questions. Well, how does a worker get to work? Do they catch public transport? Are they using masks? Are they sanitising when they get to work? So that's another factor that you have to look at as well.
I hadn't heard that before. That's a very good point. I like it a lot. What should companies in the states that haven't been as severely affected, what should they expect, do you feel, Chris, in the next month, would you say?
Look, you touched on it before. We've got significant growth in New South Wales. Victoria's had 1,500 odd cases a day for the last 3 weeks or so. Queensland, 35 cases. South Australia is starting to get cases increase exponentially as well. So I think companies should now start to expect that they're going to get a case, not that they're not. And to the point at the start, be prepared. Understand what your local health orders are, because they change rapidly. And in Victoria, at the height of, I'm going to say the 5th lockdown, but it was probably the 6th or somewhere in between there. Health directions, workplace directions were changing probably every couple of days. So be aware of what your local health directions are, health orders, and keep up to date with them, because of the rapid changing nature of, we're at Omicron now, but let's not forget Delta's still out there. The little known Lambda was there for a little while. So it's not going away in a hurry. Be prepared for it and keep up to date with what the specific health orders are within your jurisdiction.
That's something I'm going to back up 100%, because working through all of the states, I've had questions posed to me. I've gone to the government departments who have told me one thing, and I've said, just get onto your website, and they've gone, oh my God, it's changed. So quite often they aren't up to date because it's changing hourly, minute by minute, etc. Nick, would you have anything to add to that particular conversation?
Preparation is key, I think. So just subtle things like engage your cleaners and start the process of working out who can conduct deep cleaning in the event of an outbreak, and what type of process is involved in beefing up the frequency of your cleaning. Start developing high touch point cleaning policies, those type of things. Start planning now. Doesn't take much to plan it, but you want to be able to adapt and respond reasonably quickly. So I'd recommend people focus on that.
Great advice. And David, again, working across different companies, what did you learn?
Look, I think the biggest thing for our host client is, asking and consulting with the labour hire business, who is coming on, where have they been, even the account managers that are coming on site, what access will they have? I mean, the last thing you want them to do is come from one site and meet and greet a whole lot of workers and then go to another site and go talk to another lot of workers. So you have to really mitigate what their interaction on site, and where has the labour hire worker or contractor, where have they been, and what their exposure has been.
Oh, that's super. If we were to tie off, because this could go on for hours, I think, because there's such a lot of information out there. Chris, having lived through the last 2 years, looking at other states, either tying up what you've said before or adding to that, what advice would you give companies?
Look, I think we've covered a whole lot of it, and certainly if we go back to it, is be prepared. It will hit your site at some point in time. We will eventually all get exposed to COVID. encourage your staff to get vaccinated. Now, where mandates aren't in place, certainly encourage, ask them if they're concerned to go and see medical practitioners to get real advice. Don't take the advice of their workmate off the internet, because there's all these false conspiracy theorists out there. Get proper sound advice, encourage vaccination, be prepared, be flexible, and understand what the ever-changing health directions are, because they will continue to change as this virus evolves.
That's brilliant. And Nick, what would you say?
Communication again. I'd keep in constant consultation with your employees. Be out there, be noticeable, be prepared to go out on a limb. Your employees are everything, so their welfare is directly relative to your business's welfare. So put them first, let them know where you're at, and be prepared to spend some money to make sure that people are safe.
That's a great way of looking at it. Thank you. And David?
Look, my final thought was, I think, be prepared for staff shortages. You know, you're going to have staff that's, you know, the fear factor of, okay, there's X number of cases on site, you know, I'm not going to go in, or I'm sick, or whatever. I think that's what you just be prepared for that, especially for a labour hire business. And, you know, I need X number of workers, but, you know, will they throw anybody in, you know, from just to fill it? Or, you know, are you really consulting with them and giving them, okay, this is my criteria?
Thank you very much. That's a good wrap up. Gentlemen, thank you for all joining me today to share your insights and solutions. Associations are in place to advocate and support their industry, and working with collaborative people like yourself and companies can only go towards strengthening the sector as a whole. I'd like to take this opportunity to wish you all a Merry Christmas and a Happy New Year, and I look forward to seeing you all in 2022. And thank you again, gentlemen.
Thank you, Marianne.
Thank you.
Thanks.